The idea of human rights is an idea that governments have a certain set of responsibilities. And that responsibility is to address address their obligations to the population, and not pick and choose what populations to deliver services to be responsive, to identify issues. And the AIDS epidemic in Russia is an example where the government is violating rights, is deciding that a certain population doesn't have rights, a certain population the government isn't responsive to. And the specific issue is also clearly a problem in both public health and human rights terms. If the government wants to address the AIDS epidemic in Russia, it has to deliver harm reduction services. Globally, harm reduction has been proven to be effective. It's been more studied than any other approach. And there's no other way of addressing the AIDS epidemic in Russia than delivering harm reduction services. And the government's decision to pull back, to reduce funding for harm reduction, to end programs, is a decision to disregard the AIDS epidemic, to disregard the rights of individuals in Russia to effective prevention and treatment. And the response is going to lead to a continuing failure to effectively address the AIDS epidemic. And I think that you can look at that both in communities where people aren't getting access to prevention and treatment, but also you can look at it in prisons. And the situation in Russian prisons is dire, it's disastrous, and it's desperate. People aren't getting access to treatment, they aren't getting access to methadone and effective drug dependency treatment. There's overcrowding, there's tuberculosis, and the government needs to be responsive. It has an obligation in international human rights law to deliver necessary medical care. It can restrict liberty for individuals in prison, but it can't restrict access to treatment. Being convicted of a crime and sent to prison is not license to remove all access to treatment and subject people to infection, to drug-resistant tuberculosis, and to a quick course of death. And that's what's occurring.
For further information on human rights, HIV/AIDS, and to endorse now more than ever the joint statement, visit www.hivhumanrightsnow.org.